Our next speaker is Amanda Wagner from the Department of Environmental Health Sciences, who will be speaking on overcoming language barriers to advance global health.
Thank you, Dr. Godwin, for the introduction. I, too, would like to thank the Breslow Fellowship and Molina Healthcare for making this evening possible. 2014, West Africa, Ebola. Headlines everywhere. Public health professionals from all over the world responded to the crisis. There was just one problem. Most of the health-related information written about Ebola was written in English or French. Yet only 20% of the population in those countries most affected, Sierra Leone, Guinea, Liberia, speak either English or French. When Translators Without Borders, an international humanitarian translator organization, went into the situation, they had no idea the challenge they would be facing. There were not nearly enough translators. The information was there, but people weren't able to understand it. People didn't know how Ebola was transmitted, so they had trouble protecting themselves against it. They thought that a hot salt bath was an effective cure. In response to the Ebola crisis, various humanitarian organizations created the Connecting with Disaster-Affected Communities Network. This online resource includes public health information in multiple languages, focusing on disaster and crisis management. Had this tool been available during the Ebola crisis, perhaps the situation could have been managed more effectively. I believe that we as public health professionals should continue to work to overcome language barriers in order to advance health worldwide. But maybe we need to get creative. One way we could work to overcome language barriers is by having public health students learn another language. When we do our fieldwork abroad, it would be extremely valuable for us to be able to speak the language we're working in. And having more multilingual public health students would ease the burden on these translator organizations. On a personal level, I study climate change impacts on coastal ecosystems, a topic that has worldwide impacts. The International Panel on Climate Change, or IPCC, is an international panel of experts that collect and synthesize climate change findings every 5 to 7 years. And their reports are only officially translated into the 6 United Nations languages: Spanish, Russian, Chinese, English, French, and Arabic. While this reaches a significant portion of the world, there are still millions of individuals vulnerable to climate change who don't speak one of those 6 languages. By translating public health documents into the languages of vulnerable communities, we can encourage more collaboration with these nations to come up with more successful public health strategies for climate change adaptation. A co-benefit of speaking to people in their native language is increased cultural awareness and sensitivity. By providing people information in their native language, we can connect with them on a more personal level, and we show that we care about them receiving this information accurately. If we can shift the burden from being on the people receiving the public health information to the people providing the public health information, we can encourage more collaboration between nations to solve global public health problems. By having more international dialogue, we can encourage better use of our resources to target specific public health needs. Ultimately, I believe that we could be more proactive about translation and communication. We shouldn't wait for the next global health crisis to translate crucial documents into the languages of vulnerable communities. By encouraging public health students to learn another language, by translating more public health documents into more languages, and by supporting humanitarian organizations like Translators Without Borders, we can bridge gaps to advance health for all. Dhanyabad, Danki, Asante, and thank you.